No matter what happens with the health care law, the business of health care is huge. It comprises nearly 20% of our gross domestic product.
Ezekiel Emanuel is one of the key architects of the Affordable Care Act, as well as a Fox News contributor. Zeke, instead of talking about the merits of the Affordable Care Act or Obamacare versus the American Health Care Act, the GOP plan, let's stipulate both have issues in a country of 330 million people, and there is no one-size-fits-all. But let's also stipulate that we have an aging population and costs need to be reined in. So if you have a magic wand, I'm handing it to you. What would your solution be, Zeke?
Well, look, I have been arguing for a long time, certainly longer than a decade, that health care costs are a big, big concern, and we have to try to bend the cost curve and get health care inflation closer to the growth of the domestic product. There are a number of policies we need to do. Top of my list, actually, to get health care costs under control is payment change. We need to pay doctors and hospitals differently. The reason we have a sick care system, that doctors and hospitals take care of people only when they're sick, not keeping them healthy, is that we pay them when people are sick. We don't pay them to keep people healthy. So we need what the administration has called alternative payment models. We need to get off paying doctors fee for service, that is to do more things, and we need to pay them differently. Capitation, that is per person, keep people healthy, you make more money. Bundle payments, we're going to give you one payment for that hip replacement, $20,000. You figure out how to do it efficiently, and by the way, we're going to monitor the quality so you can't skimp on the quality. We need those kind of payment changes. There are many other things. We need to bring drug costs down. We know that drug costs are about 17.5% of all health care costs, and actually in private insurance they're over 20% now. We definitely need to bring the prices of drugs down. I'm very heartened by the fact that President Trump wants to do that and is very, very engaged on that. So those are just two of the many things we could do going forward to bring health care costs under control. The key here, I want to remind your audience, is that 84% of all health care spending is about chronic illness. It's diabetes, it's cancer, it's heart disease, it's emphysema, it's asthma. We need to focus on being much better about keeping those people healthy, not allowing them to get sick and exacerbate or, say, get gangrene and need an amputation if they've got diabetes, and keeping them out of the hospital. That's going to be the long-term key to actually bringing our costs under control.
You know, Dr. Emanuel, let's talk about insurance as a business, because no insurance works unless you get enough people in the pool. So whether it's automobile insurance, property and casualty insurance, when you reflect back on the Affordable Care Act, was one of the major problems, and one of the major problems that's going to face any program, is getting enough healthy people into the program. What's the solution there?
Well, you're right. For young people, right, they're sort of resistant to buying insurance. They both think they're immortal, but also, you know, they face health care costs only under very limited circumstances. Do they have severe trauma? Do they get hit by a car or fall off a motorcycle? Do they get some dreaded disease like cancer, which is rare in the sort of young adult cohort? Or do they have a baby that costs about $15,000 to deliver? Those are kind of the three circumstances in which they need health insurance, and persuading them to buy something is hard. We adopted the mandate, the individual mandate, requiring people to get health insurance or having a penalty. It's not the only approach. Another approach, which I actually think is probably much better and one that we can get bipartisan agreement on, is called auto-enrollment. Look, we're going to give you, for the basic tax credit, subsidy, voucher, whatever you want to call it, we're going to give you a basic health care plan, and then you can add up on it if you're a young person. I think that has a lot of appeal, and I think it's something we can all rally around, and that gets everyone in the system. We actually use that in Medicare for the hospital benefit. We know that the Republicans' proposal of continuous coverage, if you don't have continuous coverage, we're going to increase your premiums 30% for 1 year, actually doesn't work. Because if you're a young person, 30 years old, you say, yeah, I'm not going to pay it, and if I get sick, then I'll pay the 30% penalty, and I'll get the insurance then, because the insurance will be worth tens of thousands of dollars to me. That is actually counterproductive, not encouraging young people to buy insurance. It discourages them to buy insurance. So the Republican approach hasn't actually worked. But I would go to auto-enrollment if you ask me now.
Zeke, you talk about 80% of spending is on chronic illnesses.
Right.
But it becomes so tricky because I think we all want people to have decision-making about their health care. But when you have other people essentially helping support those who haven't taken care of themselves, how do you even deal with that?
Well, look, part of the issue, and there are a lot of places around the country who've done a tremendously good job about caring for these people with chronic illness, keeping them out of the hospital, keeping them at home, making sure they're actually taking their medications, changing their diet. The key to that is having chronic care coordinators actually co-located with the doctor. This is not about, passing a bill in Washington. It is about actually doing the nuts and bolts of care, engaging patients, not just caring for patients when they come into the doctor's office or come into the hospital. It has to be more longitudinal care, and that, I think, is going to be critical. Remember, a lot of people have health problems that are not necessarily things they can easily control, right? You have high cholesterol,
right.
It may not be yours to control, it may be much more genetic. You have high blood pressure, it's probably not yours to control. And being on a medication every day for the rest of your life is a hard thing. It gets people depressed, it makes it hard for them to engage in regular activities. What the healthcare system needs to do is support them so that they can change their lifestyle, they can take their medicines regularly. We all have to be honest. That's not so easy for us.
No.
I don't know what your New Year's resolution is, but I can bet a lot of money you violated it already. Almost all of us do. We realize how difficult lifestyle changes are, and we need a lot of support. And part of what the healthcare system has to do is stop just taking care of people when they show up in the emergency room and start helping people make those lifestyle changes.
Well, Zeke,
that is much harder work.
Zeke, I went vegan, and yes, I have eaten cheese and eggs this year so far. Zeke.
Okay. Well, first of all, I'm not so sure it's a wise idea to eat vegan, but
I'm getting free medical advice.
But I would say all of us realize how hard it is to make these lifestyle choices and changes, right? Quitting smoking is hard. Taking your medications every day of the year, getting on a scale, measuring yourself and changing your diuretic is very hard. We have to help people. So I've given you one example.
Right.
Another example is we know that people who have chronic illness frequently have depression and anxiety associated with those chronic illnesses. That drives up the cost. If we actually treat mental health of these people with chronic illness, we can bring costs down again.
You're talking
That's something we need to do more of.